According to the Sickle Cell Disease Association, 100,000 Americans have SCD. About 1 in 13 African Americans carry the sickle cell trait, and many don't even know they have it. So, since September is Sickle Cell Awareness Month, thought it'd be a good idea to visit with Dr. Stacy, Chronister, internal medicine specialist with OSU Medicine. Good morning, and thanks for being here.
Absolutely.
So, sickle cell disease versus sickle cell trait.
Yes.
We're going to talk about that, but what is sickle cell?
So sickle cell is where your cells do not have the correct shape. So it's actually an inherited disease that is, you can't prevent it. We'll talk about more about that, but it is a change in the shape of the hemoglobin. You can think of hemoglobin as being what carries oxygen in the blood cells. They're like the box cars that get your goods to where it needs to go. And because it loses its shape, your blood cells themselves actually change shape.
We have a great graphic that really shows the differences here, what I guess a normal cell would look like and then what the sickle one looks like.
I love the idea of looking at a normal blood cell, kind of like a lifesaver. You know, the little mint ones with the centers, and they're nice and pliable, and they bend and they move through tiny little blood vessels very easily. But when there's the change in that hemoglobin, you can sometimes get these sickled cells, which do not carry hemoglobin nearly as effectively, so they do not carry oxygen as effectively to the rest of the body. And because of their shape, that is where the problem lies, in that they get stuck in a lot of those small vessels, and they lead to a lot of organ damage, tissue damage.
And pain as well?
Severe pain.
Okay.
So these patients really struggle with severe infections because they can't fight off infections as well, because they have no spleen to help them fight off infections. They also end up with a lot of lung infections because the blood doesn't move as well through their lungs. But pain, because you can imagine the oxygen is not getting to their bones and to their nerves, and those bones start to die off and become very fragile.
At what point do you know you have sickle cell or the trait?
So actually a lot of newborns are screened already, so a lot of people will know even at birth, especially if they were a high-risk population and born in a hospital. The parents may be aware because they had the newborn screening done. However, a lot of children know at a young age because they go into their first sickle cell crisis, which they usually have to go into the hospital because they are so sick and in so much pain as those blood cells start sticking in places and causing all the issues.
We do want to explain who is at risk, and we've got this graphic that shows these are the most common populations.
Yes.
So what types of conversations should these folks be having?
Absolutely. Now, not everyone in these populations are going to have this, but up to 7%, maybe even up to 15% of these populations may be a carrier of the trait. So what happens is that if you have the trait and then your spouse has the trait and you decide to have a child, you may end up with a child who has the disease and is affected by sickle cell disease. So if you know that you are at high risk for the disease or being a carrier of it, you might want to talk to your doctor about getting screened for the genes for it, just to make sure you're not passing that along if you unintentionally.
How do you get treatment for it, though?
Yeah, so there's really not a treatment because it is something inherently wrong with the hemoglobin.
Okay.
So a lot of it is just symptom control, pain control, antibiotics, vaccinations. But really, if we know someone has sickle cell, we have to make sure they're very hydrated. And we say, you know, we really want you to avoid those contact sports, something that can rupture your spleen, break a bone, something that can really stress those muscles, because that is when your muscles need the most oxygen. So we say we really want you to avoid a lot of those activities and do more just aerobic activities, not anaerobic activities.
Now, the NCAA has some restrictions or some rules?
Yes, they do. So actually, if you are an athlete for the NCAA, you must get screened for sickle cell disease and sickle cell trait. However, we really don't have any evidence to say that we have to be doing that. And there's a lot of organizations out there saying that that should go away.
Gotcha. All right, so I guess the big takeaway is to have those conversations.
Absolutely.
If you're a member of that risk population, and certainly just have those conversations moving forward.
Yep, just know if you're at risk and see if you can get screened.
All right, great to see you. Thank you. I think it's important on months like this that are kind of set aside to take that time and visit.
Absolutely.
So look forward to seeing you again next